Hi, good morning. So do you think that when somebody who doesn't own a selfie stick gets one, that moves them into the realm of the cool? I'm really counting on that. I'm really glad to be here, and I feel like I'm following such important information and such an important set of presentations. And I want to just stop for a minute and try to pull some threads together of why I think this work is so important. So the first is, I think that David did such a great job of talking about passion for the work, what difference it makes when you really care about what you do and what you bring to it every day. And at HealthPartners, we have an enormous privilege. We have the privilege of doing work on the things that matter most to most individuals and to families. We have the privilege of touching people's lives in maybe the most intensely personal times of need that people have. So it's the work of being able to affect both health and financial security. And when you think about it, aren't those the two most important things that you think about relative to your own world, your own ability to have the kind of life you want to live? So health and financial security, both an area of huge passion for all of us at HealthPartners, and I think a deep understanding of the importance of that work. I think you heard it come through in Kev's, so first Kev, comments about innovation and the fact that we care so deeply about the future and about finding that place where we really deliver value and see the importance of innovation in creating a future that delivers on that value. And then you heard the emotion in Kevin's voice when he talked about his own life experience, how deeply he cares about making sure that people have access to health and the miracles that can create health, and doing that in a way that allows people to also have financial security. That's the tension that we manage. And I think it's really important that you know the people at HealthPartners bring passion to doing both. Access to the miracles and making sure there's value. And finally, Rick. I've been fortunate enough to work with Rick for a long time. And I think one of the things that we share is the conviction that we have many health professionals that still today are not incorporated as effectively as they might be in the care delivery system and in delivering on that value in healthcare. And so reshaping the role of the pharmacist within HealthPartners has been a key priority for all of us. And finally, back to David's point, you could call it something different than a day maker in your organization, but I believe the point came through loud and clear that a culture that reflects the passion for the work is a better culture. It's a place you want to work. It's a place you want to spend your life's time. It's a place you want to bring your conviction. And it makes a difference not only to the people you serve, whatever your business is, but it makes a difference to the people that you work with. We actually have a label for that kind of culture at HealthPartners. We call it head plus heart together. And it really matters because I think that's what I know it's what I want from the healthcare system. I want people who bring the best of their professional expertise to the work that we do. I want people who come in the door striving for excellence every single day. And I want people who bring their hearts with them. I want people to know and understand and care, whether it's the new medication for high blood pressure or the new cancer diagnosis. So when you think about what we can leave with today, I hope it's a renewed conviction that we can shape the cultures in our workplace. We can bring our passion to work. We can do the things that we want to do from a business perspective and do them even better because we have the heart that comes with it. So I want to spend the rest of my time this morning talking a little bit about some of the ways that we're looking at the future and some of the things that we think can make a real difference in bringing head and heart together to healthcare. Skip through the first couple of slides there. We often refer to this mental model about health when we think about what we do at HealthPartners. And it's a model that probably some of you are now familiar with, developed by Dr. David Kindig at the University of Wisconsin. And the important punchline here is that clinical care, what happens in doctors' offices and hospitals, is really important, and God knows it's really important when you have that moment that you need healthcare delivery so very much. But that's only about 20% of what determines health. And when I say health, I mean length of life and quality of life. 40% is determined by social determinants of health. Do you have safe places to live? Do people have success in school? Are our streets safe? It's the environment we live in. Do you have access to good jobs, jobs that can pay a decent wage? 30% is our health behaviors. Are we physically active? Do we eat well? Are we responsible users of alcohol, and do we not smoke? And of course, that's pretty connected to that 40%, the social determinants, because not so easy to take a walk every day if you don't live in a safe place or you don't live in a place that has sidewalks. So they're related. And then 10% are environmental factors. But I think if an organization cares about health, this data makes it clear we need to care about community as well. So I want to introduce you to a couple of examples, the things that we think need to make a difference in the future of our community. The first is children. I want to give you a little bit of information about some of the things that affect the health of children. And we know schools have a huge impact, families have an even bigger impact, but we also know that we can make a difference in how successful kids are being ready to thrive in school by what we do in the healthcare system. So, for example, we know that as early as 2 months of age, an infant whose mother has depression looks at her mother less often, is less interested in toys and objects, less active than other babies. What percentage of women have postpartum depression? Generally, it's estimated as somewhere between 12 and 18%. As many as 1/2 of American children that has a developmental delay won't have that delay identified by the time they enter kindergarten, even though those delays show themselves on average by the time a child is 2 years old. So, challenge, really big challenge when not treated or not cared for by the time a child is 5. 2/3 of students who can't read proficiently by the end of 4th grade will end up in jail or on public assistance. The importance of reading. And in California, they're using this statistic now to talk about early childhood education, and that is, in that state, a child's vocabulary by the time they start kindergarten is the single biggest predictor of going to jail. Really drives home how important thriving children are to our future, to our community, and by the way, to our workforce. Because we come from a region where the number one asset we have in terms of economic success drivers is an educated workforce. So what are we doing about this? Well, we think that we can do quite a bit to be more effective in identifying postpartum depression. Just this year, the United States Preventive Services Task Force decided to recommend routine postpartum depression screening for all women. And that's really cool. We've been doing a lot of postpartum depression screening, I think, in advance of that. But what is even more impressive is some work that we're building on that's been going on in our West Metro clinics for the last couple of years, which is to incorporate postpartum depression screening in the pediatric visit. So especially moms and dads of little ones, think about it. When things aren't going well, when you're worried about your child, when life feels overwhelming, you don't go back to the OB office, you go to the pediatrician's office. So how much sense does it make to use that opportunity to identify postpartum depression, get that screening going, and avoid that negative impact I mentioned earlier of babies who by 2 months are already a little bit more walled off from the loving relationship you want to see them have with their parents. So that's the first. Second is doing that developmental screening. In the Twin Cities, 17% of little ones are screened for developmental delays by age 3. 17. And you heard that data about the difference it makes in being ready for kindergarten. So again, we are introducing developmental screening for all kids who come to us for care by age 3, and we're working with others in the community to expand that capability in other delivery systems as well. And finally, that point about vocabulary at kindergarten, we've introduced Reach Out and Read at every one of the clinical sites that we have that treats children. And even as we were rolling it out last year, by the end of 2015, we had already given out 95,000 books. Now again, in California, there's an amazing statistic, which is that kids who grow up in middle-class homes have on average 1,000 hours of reading to them by the time they're 5 years old. Kids who grow up in poor homes average 30. So this is a very big determinant of success for little ones by the time they start kindergarten. So we really feel the investment that we make in our future is extremely important. There's a lot a healthcare organization can do. We believe that will pay off in the future, and that's an important part of shared success for all in our community. I want to tell you a little bit more about one of these programs specifically. It's called Healthy Beginnings, and it actually starts before birth. We universally screen all women who come to our clinics for drug, alcohol, and tobacco use. And women who tell us that they are screened for, and we identify use in one of those areas, we offer quick access to treatment, and we offer support during a pregnancy to make sure that a baby can be born healthy. Now, you know, it's really a big deal to be born following a pregnancy where your mom doesn't use alcohol and drugs. And in fact, fetal alcohol syndrome, huge problem. Use of alcohol and drugs during pregnancy leads to preterm birth complications. And so here's another one of those examples where we not only are more likely to have a healthy baby born, we're also likely to avoid some of those high-cost cases that Kevin was referring to in his presentation, because high-cost cases related to neonatal care is number 2 on the list of high costs, with transplants only ahead of it in the data that we see. So the wonderful opportunity here, I call this as a perfect head plus heart together opportunity to improve healthy living for kids. So here's a quick profile of a Healthy Beginnings patient.
Yes, there was a relapse in my pregnancy.
Can I hold her?
Yes.
Oh.
But with Carol calling me and being so encouraging and just, you know, not making me feel like, oh, you're a bad mother. It made me feel that you can do this still. I don't want to lose another child.
So getting her into a treatment facility where she was able to go back to with the baby was huge.
I did recover. And for 365 days since she's been alive, I've been sober, I've been there.
This is a great program. I have to say I feel fortunate to have both met Cherie, the mom in this particular story. I'm grateful to her for being willing to tell her story, and it is a story of success. Jediah, her little girl, came with her when we had a chance to meet her, and she is just an awesome little kid, and a little kid who got off to a great start in life with just a hand up and some extra support for her mother to get through a challenging time. So that is a really important element of the programs that we're putting together that we think can help kids thrive in life. I wanted to get to prescription drugs, particularly talk a little bit about opioid use, which is extremely important. Opioid addiction has really become a national epidemic, and opioids, particularly starting with prescription medications, are the chief leading cause of heroin addiction in our country. I think it's fascinating that we see congressional action on this topic, and I want you to know that we have made a lot of progress at HealthPartners already. We have been working on this for 4 years and have had a big impact in the work that we do. Now, you know, opioids are used widely in the United States. In fact, we're the single biggest user of opioid medications in the world. About 80% of the world's opioids are prescribed here in the United States. And we see there's opportunity to do a lot more effective work with benzodiazepines as well. Benzos, as they're called, are medications that people take when they experience a great deal of anxiety, stress, or panic attack. So, like opioids, these are medications that are easy to get hooked on, particularly if you're using them over a long period of time. Now, you'll recall that Kevin mentioned we've been doing a lot of work on low back pain. Well, when you start looking at low back pain and effective treatment and care for low back pain, one of the things you learn right away is a lot of people are on pain medications. And so that has been the starting place for our work on use of opioid prescribing. And now we have both data to give physicians feedback. We also have been identifying best practices that really tell us very short-term use of opioid medications can go a long way in avoiding prescriptions and ongoing prescriptions and addiction. And of course, then too, there are alternatives that can be used that are much safer for our patients and result actually in better pain control over time. So we think that is really important. And we also know that there are great alternatives to medications that we can use as well. We're very concerned about those price increases, and Rick mentioned that. So these are the medication increases for the medicines that are used most frequently to treat rheumatoid arthritis. Drug and medication costs are now the fastest growing driver of healthcare costs, growing at a double-digit pace each year. And I want you to know our trend was not double-digit last year, but that reflects a lot of the work that Rick prescribed. Even having said that, though, we think, gosh, we just can't continue in the path that we're on. There was a recent political poll that asked what people were most concerned about relative to healthcare. And answer number one was specialty medications and how expensive they are. Answer number two was paying for my own prescriptions. So we know this has become a pain point, and we think it's a pain point at the level that public policy intervention is needed. So these are the things we want to recommend and hope that you will consider how you might forward a policy agenda on this as well. So the first is cost transparency. We know very little about what it costs to develop, produce, and market medications, or we're really not even so clear on what's the profit model for medications. We think the American public needs to know that, and that there should be better cost information about medications, and that information should be public and it should be compelled. There are a lot of things about healthcare that already are subject to sunshine and transparency, and we think medication costs should be among them. We think that cost should be a factor in FDA approval. Right now, the regulators look at safety and effectiveness, but they don't really look at cost or value. And since so many of the medications that are introduced offer little additional value, we really think that value needs to be part of the proposition of looking at medication approvals. That may require some changed role at the FDA, but we think it's important to have that happen. We also think that as the largest buyer of healthcare, the federal government has important buying clout, and yet a lot of that power is left on the table because the current law prohibits Medicare from negotiating with drug companies on pricing. We think that's just plain wrong. Everything else that Medicare buys, they set a price for. Doctor services, hospital services, home health care services, medical devices are subject to Medicare price negotiations, and to exempt pharmaceuticals, we think is contributing to healthcare cost increases. So though unlikely as it might seem, we want to advocate that Medicare negotiate directly with drug companies to set prices. We also see the need for reforms to address unfair and abusive market practices by drug companies. We see manufacturers doing things to slow down the entry of lower cost alternatives, or frankly competitive alternatives at all, and we're concerned about that. We also see that high-priced medications are often supported by expensive marketing campaigns. The one that just is amazing, we were looking at this as a team. Did you see the ad in the Super Bowl? It's opioid-associated constipation. And there's now a new medicine that you can take to deal with the side effects from the other medication you are already using. So opioid-induced constipation, it's now a new illness known by its acronym OIC. Watch for the ads. We really are one of the only couple, I think there are 2 other countries in the sort of the developed world that allow direct-to-consumer advertising for medications, and we think that should be examined. Which medications are worthy of advertisement and what kind of limitations should be put on those advertisements, we think should be a better topic of public policy conversation. So we think those are important elements to contribute to controlling healthcare medication cost increases. So in this area, what can you do? Well, we think you can help support thinking differently by doing these things. Read to the kids in your life. Make sure they have books. It isn't enough to put a child in front of a screen. Help those around you turn off the screen, find a cuddly lap, and read a book. So whether you're a parent or a grandparent or an aunt or an uncle, try to take the time to make that personal difference. You can help your workforce understand the importance of children's health. And you can do some hopefully very simple things, if you haven't already, to make life easier for working parents. One of the most important things that can help chart a healthy future for a child is breastfeeding. If you can make it easier for a mom at work to continue breastfeeding her child at home by making it easy to find a room with a breast pump that's not a bathroom, let's start there. Pretty straightforward thing to do. Support policies that make medications more affordable. Now is the time. Political change is in the air. It is already a campaign issue. Weigh in. It's important. It will be a huge driver of healthcare costs now and in the future without change. And then ask those other questions and help your workforce ask them as well. Gosh, you're prescribing an opioid for me? Is that needed? How many would I need? How long would I have to be on that? Is there another alternative? And for other medications as well, do I need a medication? Could lifestyle changes make as much of a difference? If I need a medicine, what's the most affordable option? And finally, address the stigma of mental illness, because we still know that one of the most challenging conditions to treat is depression and other mental illnesses, in part because people wait so long. The stigma of having a mental illness is still too great for many to get the care and treatment needed. So help us with that as well. So, making it personal. Let's look at what it means to be well. Of course there's physical health, but that's only part of the picture. That's a little like that 20%, knowing there's 80% out there that affects health. There's also community. Is it safe? You have good places to get healthy food. Can you walk? Emotional and mental aspects of being well. Are you able to be resilient? Can you deal with the stress that you have in your life, and how do you deal with that stress? Social and interpersonal. Do you have love in your life? David's point. It's a pretty straightforward question. Who do you have that you care about and who cares about you every single day? Financial. Again, back to our sense of purpose. What's your future going to be like because of your financial stability? And then career. Do you find that joy in work? Do you actually have something that matters to you when you go to work each day? So let's talk a little bit about what can make things different at work. Personal support. One of the very important initiatives relates to depression. This is probably the #1 condition experienced by people in workplaces across our region. And we know that the impact of depression is clearly healthcare costs for sure, because it's often associated with other kinds of healthcare conditions, but it's also the cost of productivity at work and presenteeism. So people who are at work, just not operating at their best. So I want to talk about a few of the ways that we've been working to support individuals to stay well and be well who have been experiencing depression. Oops, I want to go back one. Sorry about that. Beating the Blues is a program that is actually the national program in New Zealand. It's the National Health Service program in England. It's an online program focused on cognitive behavioral therapy. It's a proven, interactive, 8-session model. So it doesn't last a lifetime. It's pretty simple to go through. It's less than an hour a week. But the focus is healthy thinking, healthy acting. It can be used as an adjunct to therapy in a combination with medication. It can be used on its own and has been shown to be very effective at helping people successfully deal with the challenge of depression in their lives. So here's some of the feedback that we see. 82% of participants wouldn't otherwise have received behavioral health care because their needs maybe weren't severe enough. So they wouldn't have gone into a doctor's office to say, I think I have depression, or they wouldn't necessarily have gone to a therapist, but did and were willing to go to an online support system. The most heavily represented age group is 50 to 64. My bet is the most heavily represented months are January, February, and March. Beating the Blues works by equipping participants with skills to help you stay resilient and to deal with stress. One of the points on that Be Well chart. Another proof point, 91% of the participants agree that Beating the Blues has helped them in their work life. 94% say it's helped them with their personal life, and more than half had improved depression scores. A really big deal, wonderful opportunity. There is no cost. You can get there through healthpartners.com, and I think all of the employers in the room could clearly help your workforce deal with the challenges that we all face by making it easy to access that particular program. Definitely can make a difference. Another innovation that we've developed capability in the last couple of years is personalized health care. So we know that mammograms can help detect breast cancer at its earliest, most treatable stages, but still there are women who don't get the mammograms that would be helpful to their health. And we rank near the top of the charts nationally in terms of the percentage of women that we serve who do get mammograms. But we found, there's something missing about the messaging when we reach out to our members. It's just not getting the job done as well as we want it to. So we used microsegmentation data to focus on 3 message categories for women. One message focused on age, I can't believe I'm 50 and I need a mammogram already. So that's one. The second spoke to convenience and affordability. Can get it nearby. It doesn't have to be a 3 months away from now appointment. And by the way, preventive services are covered by my plan. And the third presented mammograms as evidence-based and doctor recommended. The science says this can really make an important difference in your life. Once we segmented the message, we saw a 20% increase in the percentage of women in that not going to get a mammogram group who went in to get a mammogram. Really important potential impact of saving lives. Another campaign that we've developed focuses on the stigma around chlamydia screening. This one was focused on young women ages 16 to 24. We tested specific messages on Facebook to see what would resonate the most with our audience in that particular age group. This particular effort ended up with 400,000 likes on Facebook. And the messaging that was compelling was, I know I want to have children someday. Important reason to get that chlamydia screening. Again, we already have top-notch results, but we pushed those top-notch results up another couple of percentages just through that campaign. One of the greatest compliments I think our work has gotten is the state of California is picking up our whole campaign to use it across California as their public health effort this coming year on chlamydia screening. And then we use that same technique of microsegmentation and personalized messaging to make sure that our members had better awareness and understanding of options when choosing between going to the emergency room and the urgent care center. Our informatics team identified common behaviors of members who would use the emergency department when urgent care could have been an easier and more affordable and very appropriate choice for care. And so getting information to those folks with those profiles has made a very big difference. And we saw an 18% reduction in unnecessary emergency room visits on the part of those folks who were in this campaign. So, and coolest of all, 6 out of 10 households actually used the specific urgent care we recommended for them when we got that information in their hands. So the real impact of looking at members as individuals, encouraging better health by reaching out directly with messages that are personalized and that resonate with individual situations and needs. So this insights and opportunity to personalize, really big and important part of the picture. And finally, back to health at work. So I want to talk a little bit about what you might consider doing to promote a culture of health and well-being, and how we think we can help be your partner in that work. I appreciate the company involved here. I know they're at table 14, so I want to call out a big thank you to Turk for being willing to be an example this morning. In 2004, we started working with a technology manufacturing company called Turk. And at the time, facing the challenges many of us were, healthcare costs rising, and particularly understanding the impact of unhealthy employees, and that actually was having a direct impact on the bottom line. So this is Turk's initiative. This is not HealthPartners' initiative. This is work and focus that Turk adopted to create a culture within that organization, and we've partnered to support that in the ways that we can. So what the challenges were and what the ideas were began in a pretty simple way, but it's had a big impact over time. Turk has created a culture of health that has helped avoid $4.7 million in healthcare costs and has had a direct impact on increasing company earnings. Productivity went up, And 93% of employees at Turk, I love this, say they give their best efforts every day. Back to David's point. Job satisfaction increased. 89% of employees want to stay with Turk, and satisfaction with benefits increased by 13%. Along with that, turnover decreased to 1% in an industry where the average was 13%. Pretty impressive culture building impact. How did that all happen at Turk? Well, this is the timeline, which you may or may not be able to read very well, but I'll hit the high spots for you. It started with the 10,000 Steps Challenge, added more programs and initiatives. Today, Turk has an on-site clinic and pharmacy and expanded well-being benefits to employees' families, providing a range of health education services as well. But it's not like that happened overnight. With each step, Turk saw improvements and cost savings and built on that over time. So in 2005 and 2006, with supportive health and prevention programming in the areas of mindful living, healthy eating, healthy weight, and biometric screening options, that paved the way for the on-site clinic in partnership with HealthPartners in 2007. The on-site clinic became a hub of activity around health, well-being, and medical care by providing services that include screening for diabetes, cancer, other diseases, and a more comprehensive set of well-being and health programs was introduced in 2008 under the Invest in Yourself program, with a clear connection to 5 of those Be Well dimensions: financial, social, career, physical, and community well-being. On-site health coaching integrated with the clinic was introduced in 2010 to address some of the major drivers of ill health and disease burden. So, great example of a commitment to build a culture over time, starting small and building to something different. So what can you do? Well, we were recently at a meeting where a new leader used this quote about how she was approaching her work. She said she wanted to think big, start small, and act fast. I think that's true for everybody here. Thinking big, starting small, like Turk did, and then acting fast to make regular improvements in building culture. Engaging others, including us. We're happy to be your partner as you look at building a culture of health and well-being and purpose at work. Partner with us to offer solutions. We're here for that. Make sure that the program's yours. As I mentioned, program that Turk created, that's not a HealthPartners program, that's Turk's program. We're there to support. So align the work with your company's values. Use insights from data to tailor solutions and prioritize. And I hope you've heard today, we have a lot of data about health that can help you tailor your solutions, prioritize and personalize the messaging. Incorporate health, well-being, and safety, and then continue to learn and refine the solutions. So I'd like to close by taking a minute to focus on the health and well-being of each person in the room. One simple thing that every single person in the room can do that affects their health in a positive way is to practice gratitude. It's interesting, I used earlier the 4 behaviors that tend to characterize better health. Physical activity every day, eating right, avoiding smoking, no smoking, and responsible alcohol use. There's actually evidence that there's a 5th factor, and that's the attitude of gratitude. Very important. So again, a couple of simple things you can do in your life. Make your first email of the day a thank you to someone. Pretty easy to do, but a great way to stimulate that attitude of gratitude. At the end of the day, write down 3 things you're grateful for. And there's science behind this one. So maybe you don't write it down. I hope you do. But if you don't, you can think it, you can pray it, you can meditate it. And then finally, exercise or meditate daily. 3 simple things. Give that a try and see what it can do for both gratitude to others, the joy you bring someone, and the joy you bring yourself by doing it. So, in ending my presentation, I just want to call out a couple of things we're really grateful for at HealthPartners. And they relate to that sense of purpose that I talked about at the beginning. That can we make it easier for families financially? We know that still when bankruptcies occur, too often the underlying cause is healthcare costs. So can we make a difference? And together with the work that we do with you as purchasers and as members, for the 6th consecutive time, we worked with Optum Insight. So you might not think HealthPartners would be working with Optum. Not true. Each year we ask them to take the time to do an analysis of our costs compared with others in the region and others nationally. And our costs are lower. I think that represents good value. I know it represents our head plus heart together culture, and I believe it means we're headed in the right direction on really delivering that point of better financial security for the people that are our members and our patients. I'm also delighted and appreciate the support and feedback and engagement many have given in helping us create a great member experience. Our J.D. Power results were just in, and again, delighted to see we're the top performing health plan organization in our region. And I really love the fact that our member services is ranked number 3 in the country. We also scored highest on every dimension they measure, which is awesome, I think, testimony to the work that goes on in member services and in all of our administrative areas in our health plan, because we score high in information and communication, choice of provider, claims processing. I mentioned the number 3 ranking in the country for member services and coverage and benefits. And so we think this is a really important measure of accountability for us. Can we be more affordable? Can we do that with head plus heart together? And can we deliver the experience because of that heart that makes a difference to our members? And so the final thing I wanted to present is just a little bit about what the folks in our own organization have to share about why they're in healthcare, why they're at HealthPartners, and what matters to them. And I think this is head plus heart together culture come to life.
It's kind of hard to explain. You just have to you just have to experience it. I don't know how I can put it all into words.
I love helping people. That's my passion.
I love the people. I love my patients, and I love my colleagues.
And I love that feeling of being appreciated, being valued in what I do.
Doing what's right for our customers, for our members, our patients, for each other.
What I love most about my job is that I never know when a new patient comes in and is behind that door who they're going to be.
I had a phone call from a patient.
From a client.
We had a case where a woman called in.
I took care of a pair of twins.
Patient of mine, very bright, smart man.
And the rep said, you haven't had your mammogram. And, oh, yeah, I know I should go. The rep said, well, you should probably go.
When I saw him, I felt that he was depressed.
He was going to the clinic every day to get his blood pressure checked. He was supposed to get a blood pressure monitor 2 weeks ago. He just never received it. Made a couple phone calls, and he got it within 2 days.
And he said, well, I enjoyed art, and I used to draw. And I asked him to start again, and next time to bring me some.
He was so thankful, and he said, it saved time, a lot of time for him. It saved him money and his health, and he was really grateful that I took the initiative of just looking to see what I could do to help him.
And then he came back the next visit with some of his pictures, and he showed me even more on his computer. I asked him to sign them for me. He was very proud. He even signed and dated them, and he was just happy.
There was this long letter that the mom had written that said, "You guys didn't know this, but I was going to give the kids up for adoption. And the support that I got from your team is the reason I kept them."
The rep told her to, she needed her mammogram. She went and had it. They actually found a tumor, a lump. She had breast cancer. She had it removed. She went through treatment and chemo, and it always makes me cry. She wrote this letter to say, thank you, you saved my life. So it's why I do what I do. It's why we build our systems, train our reps, hire the right people. I don't mean to get all welled up, but I'm just really proud of what we do.
Being able to relate to people on this emotional level is beyond medicine. And I think just medicine is a way for me to be able to do this, have this connection.
It's those kind of relationships that I try to build with every single kid and family.
It's a very big impact.
I see it happening every day.
We don't have direct contact with our customers.
Even though we're not on the front line.
Doesn't mean we're not actually impacting the overall goal.
And we're working together to achieve a common goal of improving people's lives.
All this team, even though I'm the one that gets the credit, there's so many people behind that make that happen.
Every single person, from the person that helps you into the elevator to the person that is cleaning the floors at night, really feels as if they're contributing to the health of the patient.
My name is Tara Orm.
I'm Dr. Haytham Hussein.
Abdul Mohammed.
Sia Tao.
I'm Arthur Cofield.
I'm Dr. Edward Craig.
I'm Tom Dodge.
I'm Dr. Andrea Singh.
My name is Colleen Fletcher.
And I make
good happen.
So join us. Health as it could be, affordability as it must be, through relationships built on trust. Thank you for taking your time here this morning.